Healthcare Bootcamp webinar today. I will be presenting. My name is Shamsah. I am the CEO of Health Tech Academy. Along with me is Miranda Murphy, who is also going to be presenting in just a short while. Miranda, would you kindly introduce yourself, please?
Hi, everyone. My name is Miranda. I'm a Senior Regional Workforce Development Manager with Health Tech Academy, and I look forward to giving y'all some more information on our training.
Thank you, Miranda. So getting started, we have our slides up. Health Tech Academy, we are an online healthcare training organization. We currently have over 1,500 active students. We have a large number of coaches with us. Each of our coach and mentor has over 10 years of experience in the healthcare industry. All of the programs that we provide are on-demand boot camps, which means they are available to you online in a self-paced format. We have a super high student placement rate, which essentially means that if you go through our program, pass the clinicals, pass the examination, go through our career services, there is a very super high chance that you are going to be placed in the position that you're interested in. And although we are worldwide, our headquarters are based out of Austin, Texas. We have employees working globally. The programs that we have are available only in United States, which means that they are set up to be provided to students that want to work in the healthcare and in the medical field within the country only. So before we begin today, I just kind of wanted to go a little bit over the rules. We will be taking questions, although we will be taking questions towards the end of the webinar, so the last 10 to 15 minutes. If you have a question for us, we ask that you use the Q&A feature to ask those questions. And please, please, please wait until the very end to ask your questions, as well as to learn a little bit more about our tuition, the deals, and the discounts that we have available. So with that, I'm going to go ahead and get started and talk a little bit about Health Tech Academy, talk a little bit about our programs, and hopefully have the opportunity to answer some of your questions as well. So as I mentioned, a few things that we're going to talk about, but I want to recap real quick, is we're going to talk about the organization itself, which is Health Tech Academy, covering a little bit about who we are, what we do, our programs, our partnerships, the format of the programs itself, as well as a little bit about allied healthcare and the future thereof. So we will talk about not just the 2024, but also the 2025 and onwards on what some of the demand looks like for these programs. As everyone that's here today is interested in learning about the programs, they also want to learn a little bit about what the demand is for these programs in the workforce as they go out and try to start a new profession. So we'll talk a little bit about that. We'll talk about the programs itself, also known as boot camps. I'll be using those terms interchangeably, programs, certifications, as well as boot camps, but I'm referring to the content and the education that we are providing to our students. And then I will go into our admissions process, as well as the funding options. So the funding options is what we've found to be super informative for students that want to understand what type of plans do we have available for our students to get them to enroll for the program of choice for them. And then we're going to cover a little bit about the career services that we provide. And then you'll hear a little bit from our students and what their experience was as they went through the program, and then eventually close off with our question and answer session. So, Health Tech Academy, who we are, what we do. We have been in business and we provide education online for over 20 years. All of our programs that we have are around allied healthcare. So most of the programs that we provide, with the exception of just a few, are set up so that students can go out, obtain certifications, and be job ready, and be placed in a profession of their choice. We are based out of Austin, Texas, our HQ, our headquarters. However, all of our employees and staff are worldwide. Our goal is to really work with students and transform them and their education so that they're job ready, and they are placed in a job or that's very fulfilling and that leads to more of a career for them. And we have several number of partnerships with both universities as well as healthcare providers that lead us to complete our vision and our mission. Our vision, which I like to read out loud, is Health Tech Academy aspires to transform and innovate the way healthcare professionals are educated, hired, as well as retained. Additionally, our mission also is Health Tech Academy. Here at Health Tech Academy, we are committed to solving the healthcare staffing challenges by partnering with universities, employers, and educating citizens for emerging and diverse roles through apprenticeship, leading pathways, and career coaching. And we'll talk about that here in just a minute. So we work with a large number of coaches, mentors, which we refer to as our experts. And we also have partnerships with universities, employers, and healthcare providers so that our boot camps are very relevant and they are up to date and of quality to what is the demand in the marketplace as well as what the employers are looking for. All of our boot camps are self-paced, so the student can do it at their flexibility because we do have students that are also working somewhere and wanting to change their profession. And so they are studying as well as working, so they really appreciate that flexibility. Or they could be involved with a separate project, and therefore they are needing that self-paced component. All of our boot camps come with one-on-one coaching sessions. So as a student is moving along their boot camp and they realize that they need additional coaching or they have questions or they're coming across some topics that require additional clarification, they can schedule one-on-one coaching sessions with our mentors. And as I mentioned, that our mentors coaches are experts in the field. They each one have more than 10 years of experience. So they are there to as an asset to our students to help guide them and to help them through the various concepts as they come through. The student also has access to our career services, our career coaching. And the career services team will talk a little bit more in detail about that, but are there to provide them with assistance with items such as resume writing, getting their profiles updated, understanding how to go about looking for clinicals, and then eventually getting placed for a position. So I'm going to go into this briefly, the future of allied healthcare. So allied healthcare jobs, there's a huge demand in the market for it. There's a very big shortage. So essentially, what's happening is there are lots of more new jobs being created than individuals entering the workforce in this particular field. So there is a excess of job postings rather than a supply. So so we are seeing that gap and that shortage in the marketplace. Therefore, we have a large number of large healthcare partners that want to work with us. This trend continues to grow. We have seen this over the past few years, and we continue to monitor this. And based on the data we have and the research and the studies that we have seen externally, the positions that are perhaps in medical assistant, surgical tech, pharmacy, etc., all of these positions are slated to just grow over the next 3 to 5 years in terms of number of openings. That leads me to my next slide, which is what are the type of certifications or boot camps that we have available and that we're offering. Although we have a large number of many different programs, the ones that I'm going to touch on are probably a select few here. Some of our most popular programs are in the surgical tech area. So surgical tech, if you're interested in working in the OR and you are interested in really working with different types of instruments, this would be a position that you could grow into. The different states where that's open is mostly everywhere, with the exceptions of the states that are mentioned here at the far right under restricted states. The program is about 16 weeks, as well as we have the NCCT TSC certification program. We have this program available to individuals that have high school diploma or GED, as well as the program itself is available in the format of self-paced online, as well as one-on-one coaching session. We provide exam prep, career prep, ebooks, videos, as well as the voucher when the time comes and you're ready to go take in that certification. Apart from this, we have another very popular program that is medical assistant or CCMA, as a few of you may know. And medical assistant is a program that is also 16 weeks long, completely available online, self-paced format. And it's a super popular program because if you like being in doctor's offices or even in large healthcare systems, where you're meeting with the patient and really being that first point of contact for them, taking their vitals, talking to them about their history, this would be the position that you want to get into. This is the position that is evergreen, which I refer to as a position where there's, again, huge demand. Lots and lots of, whether it's a very large healthcare system or a small clinic or even a small doctor's office, there is always a need for MAs or medical assistants. And this is a entry-level position that a student can get into and then move more into some of the other areas, even as surgical techs or sterile processor. So there are many different careers to grow into, and this would be a really nice entry level or a stepping stone. The tuition cost is listed. However, we'll talk a little bit about funding options in just a minute. The eligibility is listed as well. And then again, as I mentioned, we offer this program through coaching sessions, online self-paced. We provide ebooks, we provide videos, we provide vouchers. This is more of a program that's open throughout the country, with the exception of just a few restricted states. I'm going to go into few more. One of them is our sterile processing program. So for students that are, or individuals that are interested in becoming, let's just say, medical assistant, just to get an understanding of the healthcare, or the medical system, they could start off as a medical assistant and then grow into a surgical tech or a sterile processor if they realize that they actually like to work with instruments and really want to get a detailed understanding of how these instruments are working, and or perhaps later move into the OR. Sterile processing could be that next step that they get into. This again is a certification that we provide. It's CRCST. And this is about a 16-week or 4-month type of a program. Again, available self-paced, and it has books, videos, and vouchers with it. The great thing about sterile processor is that it's not restricted in any states. So the program that we have is available throughout the country. It is a program that you could get into as being that initial program, and that stepping stone before you move into something even like surgical technologist. It gives really that very good overview, as well as that deep understanding of what a role like that could entail, working with instruments, etc., throughout the day. Another program where we are seeing continuous demand, and even the position that entry-level positions that this starts with has a pretty high number of or a salary, is our dental assistant program. So if you're like being in dentist offices, and you like doing x-rays or working in dentist offices, then the program that's really available for you to try is dental assistant. It is a 16-week program. The certification that it comes with is the RDA certification. The dental assistant is a program that has if you look at data over the next 3 to 5 years, where they're anticipating one of the largest shortages, as well as having that entry-level salary be higher than some of the other entry-level salaries, perhaps in the medical field. So if you like going to the dentist's office, or you like doing x-rays, or you like working with individuals that are coming in for their regular cleanings, etc., then this would be a nice program for you to explore. This program as well is available online in self-paced format. It's available with our coaches that provide one-on-one coaching session. And once again, all of our coaches are experts in their field. They have at least 10 years of experience, if not more. And they help by really explaining one-on-one concepts to individuals that may need more further clarification or topics for discussion. And these coaches really are there to assist and guide the student to help the student complete the program in a way where there's in-depth understanding, because after this program is complete, we definitely want you to go in and pass the exam, or if you're going in and doing your clinicals, and then you have enough in-depth knowledge and clarification on concepts that will allow you to do that. Again, the program itself comes with career support, as well as ebooks, videos, and vouchers. This program is restricted in certain states. So the states that this program is restricted in is to the far right. And if that is a state that you live in, I would definitely make a note of that. Other than that, we do have a large number of additional programs, such as phlebotomy technicians. If you're interested and you like working with needles, drawing bloods. That would be a nice program for you to explore. As well as medical coding. We also have medical billing and coding, which is more so of a portable career that you could work on behind in the comfort of your home if your employer allows you, or behind a desk. Additional programs that we have are healthcare IT, healthcare leadership, as well as medical health record specialist. These are all programs with certifications as well as accreditations that the program itself leads to. All of the programs that we have listed here, you can see the accreditation or the certification body right next to it, so that you have that level of information. For programs where those initials are not present or those abbreviations are not present next to it, for example, healthcare leadership, then that particular program does not lead to a certification. It could be one of those programs that are a little bit more focused on perhaps soft skills or leadership in itself. So it's set up a little bit differently. But as you can see, most of our programs do lead to a certification and are accredited. So once again, I'll just take it from the top, and instead of going through each one, I just wanted to kind of talk a little bit about our certifications, and you can make a note of the various programs that we have available, starting from surgical tech, medical assistant, patient care technician, pharmacy technician, dental assistant, sterile processing, phlebotomy technician, medical coding, healthcare IT, medical health record specialist, EKG, healthcare leadership, as well as pharmacy technician professional. With that, I'm going to talk a little bit about our admissions process. We like to keep the admissions process fairly simple and straightforward. We do that so that everybody has a successful chance at completing the application, yet they get all of their questions answered. And if they need any assistance, then they're able to work with their admissions advisor. So the first step really is to schedule a call with your admissions advisor. An admission advisor is an individual that will review your application with you, provide information on the program of choice, assist you in really explaining if that particular profession or career choice is the right one. We also have career assessments, career quizzes, various questions that we ask individuals just to make sure that the career that they're wanting to get into is something that they could be in long term. So that admissions advisor is very personalized and works with the student. So that would be step one. Step two is to discuss the program details and the eligibility requirements. That includes information such as background, education history. It also includes states where there may be restrictions. So if you are in a state that unfortunately we cannot provide education in, then we will work with you and let you know that information so that you can make the choice and the decision that you want to make as a next step. And then the admissions advisor works with the student around tuition and the enrollment into the preferred bootcamp. And as I mentioned early on, there are many questions around tuition cost, and different funding options. So going into the financing options that we have open and available, the list is fairly long. However, this is the piece that I want to focus on quite a bit. A student, an individual can definitely pay upfront. We do have discounts available. You can work with your admissions advisor on understanding what those discounts are. If you pay the tuition cost all up front. The second financing option is monthly installment. These are installments that are available and scheduled through payment plans through our financing partners. We work with several different partners, some of which are listed here that I am going to highlight. So hopefully you were able to see the highlighted information. I will also read them out loud. They are called Fortify, Edley, and Sally Mae. You can make a note of this, or when you talk to your admissions rep, the admissions advisor will be able to go over each of this and provide you with links and more information on each of these different financing partners. The terms are different for each of the financing partners. However, they are available to you to apply with. I will say that our partner for Fortify does approve every single application that comes through. So please don't be discouraged that you may not get approved. We do have financing partners, or rather I should say we do have a financing partner that does approve every single application, and that is Fortify. Other than that, we have options such as study now, pay later, and we have a partner, a firm that assists with those students that just want to study today, but however pay later. You can talk to your admissions advisor again on the eligibility, the application process, and where that might be available for you to apply. Further, if you are a military spouse, you may be eligible for MICE EAA or military education benefits. Typically, these are students that are spouses of active military. And lastly, we have Workforce Innovation Opportunity Act, also referred to as WIOA. You have to be eligible, and then you have to get approved. There's an application process with this particular funding source. And this is a funding source that Miranda will be discussing a little bit later, actually, maybe in the next 5 minutes or so. I am trying to move my screen. Give me just a minute. Well, thank you for waiting. I'm going to go into the next slide, which is our healthcare career services. So this is definitely a question that's on everybody's mind as well. What kind of career services does HealthTech Academy provide? And we definitely want to be very, very upfront about this so that everybody's making a informed decision. We want to work with you. We want to ensure that you get into a position that is going to be a right fit for you and your career choice. So the current careers services that we provide include information around resume writing, technical questions if there may be, and then we work with you really on finding the right clinicals, for you. We work with you on exactly what type of organizations are available to you based on your program of choice. And we explain the process on how you can land your first job or even that clinical, if that's what you're doing. And we have a team that's available that you can work with that provides one-on-one guidance, so one-on-one career services and coaching sessions. Here's that information. So career advising, as I mentioned, you can book one-on-one coaching sessions, and those typically start as you are halfway through your course. We also have our career prep course that empowers you with the skills, both hard as well as soft skills that may be needed for you to succeed. We help you with professional profiles all around LinkedIn, resume writing, something that really helps you stand out in front of the employers. And then we work with you on interview prep as well as practice. And with that, I am actually going to go back up into our WIOA or WIOA Workforce Innovation Opportunity Act and give the slide to Miranda. Miranda, on to you.
Awesome. Thank you. So just a little bit about the WIOA grant. You'll often hear it referred to as WIOA. It's Workforce Innovation and Opportunity Act. This is a federal grant, so every single state across the United States offers it. Some of the qualifications can vary per state and per county, or if you're in Louisiana, parish. But the primary demographic that WIOA is looking at is, are you unemployed? Are you underemployed, or do you have a significant barrier to employment? And so if you're eligible for this grant, I'd say 9 times out of 10, it covers the entire cost of our training. They will only let you select one program, so we'll want to make sure that that one program that you select is a good fit. So there's 3 different ways to qualify. I'll go through each one. The first program is the WIOA Youth Program. This is for anybody that's 18 to 24 with a significant barrier to employment. So what case managers are looking at is, I'll give you some examples. Did you have a child young? So parenting or expecting. Do you come from a low income background where your parents could be collecting some type of government aid such as SNAP or TANF? There are certain zip codes in the United States where if the poverty level is above 75%, you're automatically eligible for this grant. That's adults and youth. It could be if you were in the foster care system and you aged out, same thing, you can be eligible for the youth program. So they are looking for a significant barrier with that one. The second option is the dislocated worker grant. This is designed for somebody who has lost their job through no fault of their own. So either a layoff or the position could have been done away with, whatever it might be, and you have to be collecting unemployment. So I always let people know, if you lost your job, apply for unemployment. Once you get approved, then you can be eligible for this grant, because we do have a lot of people that they lose their job and don't want to apply for unemployment. That will not make them eligible for this grant. You will have to collect your first check in order to be eligible. And the third one is going to be the Adult Learner Grant. So this is for anybody that is above the age of 18. They're looking at, are you collecting SNAP, which is going to be food stamps, or TANF, which is temporary aid for needy families, or low income? The qualification, it's across the board, is $7,500. You can't bring in more than $7,500 in the last 6 months in your household. So if you are married, they will take that into consideration, and they will also increase that amount for each child that you have. So can you scroll down to tribal funding? Thank you. So another grant that we have available is well, there's actually a lot of them, but we have a partnership with Native American Jumpstart, and they are a nonprofit. We have a formal partnership with them, and what they do is provide education grants to um, any member that's enrolled into a federally recognized tribe. So you will have to have your tribal card in order to go through this process. They do partial scholarships or I should say grants, partial grants, fully funded grants. If for whatever reason, if an individual didn't qualify for the full grant, we would connect with that tribe to see if the difference can be covered, because most tribes do have higher education departments, vocational rehab departments, and workforce development partnerships to be able to get the cost of that program covered. So if there are any questions on the WIOA grant or the tribal funding grants, I'll answer those questions at the end. So that is it.
Thank you, Miranda. I appreciate all that information.
You're welcome.
I will scroll down to our student testimonial slide. So as mentioned earlier, we do have quite a few number of students that have gone through the program and like to provide feedback around the experience that they've had. And super proud to say that our students are having a positive experience. We are currently at 4.7 out of 5 star ratings, and some of the information in terms of comments are also visible to you right here. You can always go to Trustpilot, and trustpilot.com has a lot of information as well, or reviews on Health Tech Academy that you can review. We do take feedback, both positive as well as not so positive, into consideration and very seriously, as we are looking to improve every single day here in terms of quality of education, customer success, student success, and we want to provide an overall great experience to any of our students. I will play at least one of the video testimonials for you so you could hear it directly. Just give me a second.
My name is Efta Deshwathobi. I currently live in Miami, Florida. My aim is to do surgical tech, and I was able to find that out through Health Tech Academy through a referral of my sister, which we both signed up at the same time, and I'm pretty glad that she did, because of the help with Health Tech Academy, with the fact that it is accredited with NCCT, which was an important factor into signing up and getting the help that I was able to receive from the career coaches, from the teachers, the professors, things like of that nature, has been instrumental in the success rate of being able to work in a hospital. Looking for accelerated programs, the Health Tech actually were able to pop up again. It was a referral, but she had to do the research, and from there, that's when she found out it was accredited through NCCT. When going through this, I definitely looked into it. I did my research and I asked plenty of questions. Don't be afraid to ask questions. And that's what made me feel comfortable. They are on top of it. Please do the work. If you really want this, just do the work. Know that you want it, and just ask a bunch of questions. They are more than happy to help. I chose surgical tech because of the fact that it is rewarding. It's a team collaboration in a surgery. It's when the patient is in their most vulnerable that I get to be a part of that experience and their memories. And when it comes to the content, the modules and the courses and the exams, just study. I take out my notebook, I write, and I study and watch the videos, and then I go above and beyond and I watch some more so I can get a better understanding of it, so I am prepared for the exams. Again, it is not that hard. As a current alumni with Health Tech Academy, I'm now in the process of interviews with hospitals, getting the hands-on experience so that I can be fully certified and not only get my clinical hours, but to be fully certified with NCCT. So they both go hand in hand, and that's where I'm at right now. And I'm definitely getting the help, more than enough help. And they're helping me sending out the emails, finding more hospitals in my area. I'm helping them let them know about the open positions for those who are also in Miami so that we can start this new journey.
Well, hopefully you got a chance to listen to that. I will go back to the presentation itself. We are more than happy to send you, if you would like, additional testimonials for review. These are also available on our YouTube page for Health Tech Academy. If you like, when you're working with an admissions advisor, they can send you these as well, so you can listen to them in a little bit more detail. As I mentioned earlier, when I was going through the programs itself, some of our more some of the programs that our students are more interested in are the medical assistant, the surgical tech, as well as our dental assistant program. So you can get a nice flavor for each of the students in the various programs that we have had, where they are currently an alumni and have completed the program, and what their experience has been. So we have that, all of this information available on our YouTube page. With that, I will open it up for some questions. Again, want to let you guys know that you can type your question into the chat, and we will be more than happy to look at them and answer them right now.
I do see that there's a few WIOA questions that have been asked, specifically about California and Washington or Michigan. So it is a federal grant, but we are in 18 states. So if for the WIOA grant, so if you had spoke with someone that said that it wasn't available in that state, then it is a state that we don't work with for WIOA.
Thank you, Miranda. There is a question if they're from a student that they're not able to pay upfront, should they apply for educational assistant? And I would recommend that you work with an admissions advisor, and the admissions advisor will be the right person to guide you on the various different education and the funding sources that are available. The reason why I say that is because the admissions advisor is very knowledgeable and has worked with many students. So they can provide you with the right information. If you directly go and apply somewhere, it's possible that you may not find the relevant information and may get discouraged. So therefore, I would like, if you're interested and the only thing holding you back are the financing options, I would say please work with please work with an admissions representative. There is a question around syllabuses. So yes, the syllabus, you can download it directly from our website or connect with an admissions advisor, and the admissions advisor will be able to send that to you. We have a syllabus available for all of our programs. It shouldn't take that long at all to get that information over to you. So if that's what you're wanting to do, you can connect with our admissions rep and we'll get it they can get it over to you or look on our website. Then we have a question around laptops. We do provide laptops as well. If that is needed, you have to be eligible, you have to apply and be eligible for it. Again, various ways in which we can ship a laptop over If you are part of a grant that where the laptops are provided, we will send that to you directly. If you are going through funding options where you can add the laptop to your funding option and get approved that way, we can provide a laptop that way as well. Then we have a student that's or an individual that's in Florida and they would like to get started. We would like to know which program you're interested in getting started with to see if it's eligible in Florida. And if it is, then we would love to work with you to enroll you for the program of choice. With regards to how does financing with Fortify? So Fortify is our financial partner that approves, as I mentioned, every single application. There is a link that I'll put in here in chat in just a minute where you can go and you can submit your application. As soon as I think it takes less than 5 minutes. As soon as you finish the application, you can work on the enrollment process with one of the admissions advisors. I am waiting to see if there are additional questions.
I do see where someone asked if Surge Tech is available in Illinois, and it is.
Thank you, Miranda.
You're welcome.
Again, if you're looking for the syllabus, you can either get it directly from our website or you can call our admissions rep and then we can do that. I am with Fortify, you can apply to get a laptop. And if you get approved, then we can ship that to you. So if you have questions around accreditation or discounts and promotions, I do see some of that coming through from a particular student. I would encourage you to work with the admissions representative. The admissions representative will be able to answer that and all the questions related to discounts pretty quickly. There is a question on surgical tech around finishing the program or finishing the clinicals before taking the exam. So it depends on state by state regulations there. Most of the time you could do it in parallel, but we would just need to understand that what state you're in and if you qualify to do that. There is a question around financing. If you have student loans or you have not completed bachelor's or anything along those lines, you are still eligible, yes, for financing options. Again, it depends on which financing option you want to tap into, whether it's one that Miranda talked about, or military education spouse benefits, or just going directly through Fortify. At any rate, there are many options available to you as a student. And if you have previous student loans, that's fine. It's not a blocker. You can still apply for additional funding sources. Okay, how do you connect with an admissions rep? That's a question that's come up and it's very timely. So if you'll if you're reviewing our screen, you can see that we have QR codes available to you. To talk to admissions, you can open up your phones and scan the QR code, and then admissions rep will be in touch. We also have a phone number here that you can text, call, or an email if that works easier for you to connect with admissions, and then admissions rep will quickly get in touch with you. Other than that, if you are still wanting to find out a little bit about, hey, which program maybe it's the best, you can always take a career assessment quiz. That's the QR code is up here for that. And in the quiz, it is completely free for you to take. It based on the questions and the answers that you provide. The quiz will be able to guide you a little bit in terms of what profession would be best suited for somebody with your interests. And the results are pretty immediate. So I would encourage you to take that. If you want to just learn a little bit about our website or visit our website, take a look at our learning platform, take a look at our programs, feel free to scan the QR code here. And this particular QR code will take you to our website. You can review articles, you can review testimonials, you can review information about our programs. There are also some questions around, will the slides be sent? These slides be sent? Yes, these slides will also be sent out to the registrants after the webinar, so you can review them. And if you have questions about surgical tech and enrolling in the program without any background necessarily in medical or in the healthcare industry, I would encourage you to talk to admissions, and admissions rep will be more than happy to guide you. And with that, we are at the end of the webinar itself. I want to thank everybody for joining today and providing their time and their attention and asking such wonderful questions. Thank you so much. We hope that you gained a lot of information about our programs, why we're here, and the experience that some of our students are receiving. Additionally, we hope that you choose Health Tech Academy in your education journey as you move forward. Please do not hesitate to reach out to us, whether through our website, our admissions line, call, email, text, in any capacity. If you have any questions, we're here to help you. That's our mission. That's our goal. Our goal is to work with students and to place them into positions and help them change their careers. And we have a large number of funding sources through which we help our students every single day. And we hope to be that change in your life and when you are out there making a decision and considering many different schools and programs. So thank you so much for making the time today. Have a wonderful afternoon.